Hey class, today I'm going to be talking about post-amputations and how occupational therapy can assist and assess these patients. Occupational therapy will help increase a person's strength, flexibility, and coordination, and introduce adaptive equipment and techniques to assist in independence and becoming more comfortable with their new stump or residual limb, and working on safety with those things. Occupational therapy can help patients become more independent, improve their quality of life, and adapt to their new circumstances. Occupational therapy can assist with overcoming emotional and psychological aspects that they may experience. The most common amputation is a lower extremity, due to vascular disease, diabetes, or trauma. You will get some upper extremity amputations, mostly from trauma. OTs will assess equipment needs, home and work environment, returning to their community or leisure activities. That we will also teach new techniques and strategies for ADLs and IADLs. We will provide wheelchairs or other appropriate seating. We'll suggest for home modifications such as stair lifts, bathroom adaptations, ramps, and kitchen alterations. We'll give advice on vehicles and adaptive driving, and we'll also create fatigue management programs for those patients. Something else that we need to consider is the post-surgical site. We want to look at the healing, make sure there's no infection starting. And we also want to, during the evaluation process, which we'll get into later, we want to, make sure that the patient can put on the shrinker, and then eventually we'll work with them on, we'll reach out and get them fitted for a prosthetic. We'll work on maintenance of that prosthetic. We'll work on them donning and doffing appropriately to make sure that there's proper fit. We're also wanting to, help them get back into somewhat of a normal life, with or without the prosthetic. Some patients may determine they don't want one or need one. So we want to show them compensatory strategies to be able to continue doing the activities that they prefer. Some assessments that we could use during the evaluation is the activity specific balance confidence scale, and that is a self-report quality of life outcome measure relating balanced confidence to functional activities. We could also use the Trinity amputation and prosthesis experience scale, and that is to examine the psychosocial issues related to adjustment to a prosthetic, specific demands of wearing a prosthesis, and potential sources of maladjustment. And then another one we could use is the Barthel Index, and that is a scale used to measure performance in activities of daily living. Each performance item is rated on the scale with a given number of points assigned to each level of ranking. Those are just a few of many specific to amputations for during an evaluation process. During that, depending on the type of amputation, you want to, of course, assess balance. You want to assess, that phantom pain. Sometimes we need to, really dig into that phantom pain, because that will become a barrier to treatment and healing, because to them it's very real, and that pain becomes a deficit, and inhibits them from being able to participate more with therapy and really get stronger, so that way they can carry on with their life. Post amputation is such a big important issue. When I was on my inpatient rehab, I had 4 or 5 new amputations that we were working on, and having to teach them transfers, bathing, dressing, and the safer ways to do those things. We also worked with the caregivers to make sure that they knew how to assist their family member once they came home. Um, and then, so during the evaluation, I made sure that I wrote goals for the patient to be able to don and off their shrinker, so that way they would be ready and prepared for the prosthetist to come in and fit them, and make sure that their new limb didn't get bigger or anything like that, and they were prepared. But just you want to work on safety because they may forget that their limb is no longer there, and they go to transfer and they stand up, they have a more increased risk for falls. So there's lots of information, lots of education that we can dig into with these patients and make sure that they have a successful recovery, and then they can move on to the next stage of their life. But that's my video. Thank you.